Next, I would like, it's my pleasure to introduce Dr. Olufolakemi, who is coming to us from Nigeria and is going to be continuing on the theme of people with albinism and talking about her impactful care. On a personal note, I have to say that she's also my mentee, so I'm proud of everyone, and then she's definitely has a little special place in my heart as well. So please welcome.
Good morning, everyone. I'm Olufolakemi, consultant physician dermatologist from Lagos, Nigeria, and Mentee in the 2024-25 cohort. I'm going to be talking about enhancing care, empowerment, quality of life for people with albinism in Nigeria. Now, as we know, oculocutaneous albinism is a genetic condition characterized by reduced or absent melanin in the skin, hair, and eyes. It's prevalent in sub-Saharan Africa, and about 0.5% of the population in Nigeria have albinism, about 1 million people. And now people with albinism face significant medical, social, and economic challenges that affect their quality of life and expectancy in Nigeria. Now, this sad situation is what we see quite often. A young mother with extensive SCC on the face. She had no photoprotection knowledge at all. She thought it was a spiritual attack and was also misdiagnosed as an infection and abandoned by husband and couldn't afford care. And this is what we see quite commonly. And a study done in Lagos in my hospital showed very poor sun protection practices and a high burden of skin cancers in over 70%. Sunscreen is not available or affordable for most people, and there's a lot of issue of late presentation and lack of affordable care. So all these challenges, lack of ignorance, low healthcare access, visual impairment, social stigma, discrimination, poor sun protection practices, and all these contribute to late-stage skin cancers that we see quite often and is quite devastating and often lead to death. And so we realize that the solutions that we need are beyond the clinics, and to improve the quality of life of people with albinism, we need to do more than just see them in the clinic. We need to educate them, the people with albinism, their families, teachers, and the public on albinism. We need to enhance access to quality, affordable care, and also we need to advocate for subsidized care as well as inclusivity in governments. And we also need to empower, motivate, and equip people with albinism to also push for change in their communities. And so we started this project with a lot of brainstorming with my mentor on sun protection, education, and advocacy, educating parents, teachers, and people with albinism on sun protective measures. We have a walking policy in our clinic for people with in dermatology for people with albinism. And we also have regular sunscreening, or encourage it. We trained health workers on albinism care, and this government now subsidizes some of the care for free 5-fluorouracil, cryotherapy, and surgery. There's also a lot of mass media campaigns on albinism awareness, myth busting, and fighting discrimination on social media, radio, television, and advocacy on visual challenges and the need to create inclusive work and school environments for people with albinism, as well as inclusive employment policies. And the Lagos State government, from some of our efforts, has now registered albinism as a disability and provides some free preventive and therapeutic care. And in empowerment, the Lagos Albinism Support Group is a safe space for encouragement, enlightenment, and peer-to-peer education for people with albinism to encourage themselves. And there are also some skills acquisition programs. And the Lagos Albinism Society has birthed a nationwide albinism association that's doing amazing things in the albinism community. And I was very honored to be able to be awarded a research grant by La Roche-Posay to evaluate the quality of life of people with albinism and the impact of therapeutic medical education on their quality of life. And this is an ongoing project that will be presented later in the year. This is an example
people, this
of what we are creating. Sorry, please go ahead with the video. I was hoping I could play the video so you could see. Okay, I guess it's not playing still, but it's an animation that talks about albinism in local languages, in Pidgin English, to educate the public and people with albinism about the condition. So I'll on a note I'll say albinism is not a reason to discriminate, it's a reason to celebrate adversity. And I'd like to say a very big thank you to my mentor, Dr. Kari Wanat, for her guidance and her mentorship, and all the GLODERM family, the International Foundation for Dermatology, the ILDS, La Roche-Posay for the grant funding, the Nigerian Association of Dermatologists, and of course, CeraVe, our amazing support sponsors. Thank you very much for listening. Thank you. Okay, oh, so sorry. I hope my time isn't up. Okay.
My country people, this important message that open our eyes to understand what be albinism. Albinism na genetic condition when person they inherit from him papa and mama. This condition they make them hard for the skin, eyes and ears to produce enough of the normal skin pigment when Oyibo they call melanin. People when get albinism get poor eyesight. You know they take before their skin they quick old, and them fit suffer skin cancers when ultraviolet rays from the sun they cause. People when get albinism must try to avoid anything when go make them stand under sun for long time. Person when get albinism must wear clothes when go protect his skin, wear glasses to protect his eyes, and use cream when then they call sunscreen anytime when the person dey outside during the day. It also dey important for the person to visit skin doctor when Oyibo they call dermatologist every 6 months. Albinism no be disease and it no fit spread from one person to another person. People when get albinism na normal people when get sense and when they live like every other person for inside our society. It dey very wrong to discriminate against them. This message na from Lagos State Office for Disability Affairs LASODA and the Albinism Association of Nigeria.
Thank you.